Welcome everybody. In today's video, we're going to cover 50 must-know high-yield questions for your ophthalmology exam. These are all high-yield questions that you'll likely encounter during the exam. So the first question is as important as the last one, so stay tuned through the entire video. So here we go. Question number 1. Most common type of glaucoma. So you will encounter during your exam that they're going to ask you what's the most common, what's the next best step, what's the most side effect of this medication, what's the mechanism of action. All of those are high-yield information that you should be familiar with to get higher scores. So the most common type of glaucoma is open angle glaucoma. Question number 2. Strabismus should resolve by what age? So you're going to give a question stem with a patient that has diagnosis of strabismus, and they're going to ask you this should likely resolve by what age, and that is 4 months. If it's not resolved by the 4 months, we should be getting an ophthalmology referral for that patient. Itchy eyes is most likely what? Patient presents with itchy eyes, that is most likely allergic conjunctivitis. Why should we treat pediatric conjunctivitis? Well, we should treat it because 50% is bacterial, so treat even if you suspect that it's viral. So it's a 50-50, just be safe, go ahead and treat any pediatric conjunctivitis. Treatment for pediatric conjunctivitis. So that would be Ocuflox drops, 1 drop 4 times a day till clear for 2 days. So in the question stem, they can actually tell you they're going to treat it with Ocuflox drops, and they're going to ask you for how long do you treat it. Till clear for a day, 2 days, 5 days, 7 days. The answer is till it's clear for 2 days. Question number 6. Orbital cellulitis treatment. When it comes to the treatment of orbital cellulitis, that needs to be treated with IV antibiotics, and it's usually vancomycin and clindamycin. So orbital cellulitis, IV antibiotics, vanco or clindamycin. Number 7. Most common population affected by orbital cellulitis, and that would be children. So children are most commonly affected by orbital cellulitis. Now, so guys, for all of you that already subscribed to my channel, thank you very much. Thank you for leaving all those beautiful comments. It truly means a lot to me. For the rest of you that haven't, please check around. I made a video for every class of Didactic here for all the EORs, just like this, 50 high-yield questions. I organized them in a book. You can find it on Amazon. It's only 20 bucks. And I just wish I had something like this when I was in PA school, because it would significantly help me with studying. And do check it out. See if there's something that works for you. So here we go. Question number 8. How to tell pre-septal cellulitis versus orbital cellulitis. So in the question stem, they're going to try to trip you. They're going to ask you about pre-septal versus orbital cellulitis, and the easiest way to differentiate it to pain with the ocular movement and decreased vision will be present with the orbital cellulitis. So in the question stem, if the patient has pain with moving their eyes and they describe decreased vision, you should be thinking about orbital cellulitis. Pre-septal cellulitis should not cause pain. How to diagnose orbital cellulitis? For these patients, you're going to order a high-resolution CT scan. So CT scan is used to diagnose orbital cellulitis. Most common bugs causing bacterial conjunctivitis. Bacterial conjunctivitis is most commonly caused by staph and strep. Staph and strep, bacterial conjunctivitis. Bacterial conjunctivitis will present with what? They will present with that purulent discharge, that glued shut eyes on awakening in the morning, and an absence of ciliary injection. So they're going to tell you they got discharge from their eyes, and when they wake up in the morning, they have a hard time opening their eyes because they're almost glued shut. That all leads to bacterial conjunctivitis. What bugs should we think about covering in contact wearers? So they're going to tell you this patient wears contacts, and every time the patient has contacts in a stem, you should be thinking about Pseudomonas. So cover Pseudomonas if patient wears contacts. Eye pouring out pus, you should be thinking about gonorrhea. So in the question stem, they say the patient has pus pouring out of their eyes, that is gonorrhea. Screening test for strabismus. Strabismus is screened with the Hirschberg Corneal light reflex test. Hirschberg Corneal light reflex test for strabismus. Number 15. If strabismus is not corrected by the age 2, what can develop? These patients, if they don't get this corrected, they can develop amblyopia. Amblyopia, if not corrected by the age 2. Painful red eye with a fixed pupil describes what? So in the question stem, they're going to tell you patient has painful red eye and their pupils are fixed. This describes acute angle glaucoma. Acute angle glaucoma, painful red eye with a fixed pupil. Associated with the loss of central vision and blurring of vision. If there's a loss of central vision, you should be thinking of macular degeneration. Loss of central vision, macular degeneration. Presbyopia is what? This is age-associated loss of ability of the eye to accommodate. So they're going to tell you this is an elderly patient that has lost their ability to accommodate, and they're going to ask you what's the most likely cause, and the answer is presbyopia. Glaucoma, if it's left untreated, can lead to a loss of peripheral vision, not central, and eventual blindness. So glaucoma, peripheral vision. Glaucoma is the most common cause of blindness in which race? That would be African Americans. So if they talk about elderly African American patient, and they're going to talk about the blindness, and they're going to ask you what's the most likely cause, the answer is glaucoma. Itching of the eye is not typical of acute angle glaucoma. It is most consistent with what? It is most consistent with allergic conjunctivitis. Itching eyes, allergic conjunctivitis. Painless monocular vision loss should make you think of central retinal artery occlusion, CRAO. Keyword is painless. So if they have painless vision loss, you should be thinking about CRAO. Exophthalmos is seen with Graves' disease. This is when the eyes are bulging out. It's abnormal protrusion of the eyeball. Exophthalmos, Graves' disease. Gradual loss of peripheral vision should make you think of open angle glaucoma. So remember again, glaucoma is associated with peripheral vision loss, and it's usually open angle glaucoma with a gradual loss. Acute unilateral painful vision loss, vomiting, and seeing halos around lights. This should make you think of acute angle closure glaucoma. Keyword being painful vision loss. You're going to have vomiting and seeing halos. So this is acute angle closure glaucoma. 26. Slit lamp examination reveals cells and flares in the anterior chamber. This should make you think of iritis. Cells and flares, iritis. Fundoscopy will show boxcar look or a cherry red spot. CRAO. Again, central retinal artery occlusion. And CRAO sounds like cry. So I cry when I see red cherries. So when do you cry? Well, I cry when I see red cherries. Red cherry spots, CRAO. Again, check out a book, guys. I think it will significantly help you with your studying. It's on Amazon. It's $20. Hit that subscribe button. Now let's continue. 28. What's Blepharitis? This is inflammation of the both eyelids, common in patients with Down syndrome and eczema. So in the question stem, they're going to tell you this is a Down syndrome kid, or they can tell you this is a patient that has reported eczema and they got inflammation of the both eyelids, and they're going to ask you what's the most likely cause of this, and that will be Blepharitis. What's posterior Blepharitis? Posterior Blepharitis is meibomian gland dysfunction. Meibomian gland dysfunction, posterior Blepharitis. Foreign body sensation, tearing, red, painful eyes, this is all consistent with corneal abrasion. So if somebody says they have tearing, they have the eyes red, it's painful, and they have that foreign body sensation, something got stuck in their eye, this is likely corneal abrasion. Corneal abrasion fluorescent staining will show what? It will show the ice ring or a linear abrasion. Make sure to invert the eyelid to remove the foreign object. Ice ring, corneal abrasion. Most common cause of corneal ulcers. So the most common cause of corneal ulcers is a bacterial, Pseudomonas. Again, contact wearers can also, you need to cover Pseudomonas. So corneal ulcers, bacterial, Pseudomonas. HSV keratitis will show what on a fluorescent staining? HSV will show that branching, that tree branching. So if you see a tree branching on an image, you should be thinking HSV. What's the infection of the lacrimal sac called? So that is dacrocystitis. Dacrocystitis is infection of the lacrimal sac. Most common bug that causes dacrocystitis, that would be Staph aureus. So Staph aureus dacrocystitis. Dacrocystitic presentation. This will be the tenderness, erythema, redness to the medial canthal, nasal side of the eye, of the lower lid, may be purulent as well. Ectropion happens due to relaxation of which muscle? Orbicularis oculi muscle. So in the question stem, they're going to tell you this is ectropion happening due to relaxation of which muscle. They're going to list 4 different muscles. So if you just remember orbicularis oculi muscle, like OO ectropion, it's how I remembered it. So I just always look for OO muscle, orbicularis oculi muscle, ectropion, OO ectropion. Glaucoma vision. Again, we'll cover this. So this is a peripheral vision, goes out first, looks like a tunnel vision. Glaucoma diagnosis. With the patients with glaucoma, they're going to have increased intraocular pressure by tonometry greater than 21. So 21 is a key number in this high yield. So greater than 21, you should be thinking glaucoma. They take glaucoma test after they turn 21. So greater than 21, that's how I remember that. They take glaucoma test after they turn 21. How do we treat glaucoma? It is treated with ophthalmic emergency, refer immediately, and is treated with IV acetazolamide as a first-line treatment. IV acetazolamide treats glaucoma, ophthalmic emergency. What's definitive treatment for glaucoma? Well, that would be the LASIK or surgical iridectomy. What's hordeolum? Hordeolum is the abscess of the eyelid margin, painful, warm, swollen, red lump on the eyelid. So painful, remember H for hurts. So it could be hordeolum, could be pendiculum, or whatever other terms they throw at you, but just remember H stands for hurts. Eyelid hurts. If there's an abscess, that is hordeolum. Most common cause of hordeolum, and that would be Staph aureus again. Hordeolum treatment, well, we're going to treat with voracompressants and mainstay of treatment, and then incision and drainage if no spontaneous drainage after 48 hours. So in the question stem, they can tell you this has been 3 days since they've been applying the voracompressors. What is the next step? Well, in that case, you're going to cut it and drain it. And if it's less than 48 hours, just keep applying the voracompressors. Macular degeneration presentation. With the macular degeneration, you're going to see that bilateral blurred or loss of central vision. Glaucoma is a loss of peripheral vision. Peripheral glaucoma, central macular degeneration. Patient with a macular degeneration can see straight lines appear as bent lines. What is that called? That is called metamorphosia. So in the question stem, they can tell you this patient comes in, they got issues with central vision and they're seeing bent lines. They're going to ask you what is this called. So that is metamorphosia. Drusen spots should make you think of dry macular degeneration. Drusen spots, dry macular degeneration. Swollen optic disc with blurred margins should make you think of papilledema. Swollen optic disc, papilledema. What is pterygium? Pterygium is a flashy triangular shaped fibrovascular mass, most commonly in the inner corner of the eye. So it has that triangular shape, inner eye, think pterygium. Pinguicula is yellow, and I would just remember the yellow penguin. I would imagine a yellow penguin, and if there's yellow mass reported in eye exam, I just think of pinguiculas. So flashy triangular shape, pterygium. Blood and thunder on fundoscopy should make you think of CRVO. Blood and thunder, CRVO, red cherry spots, crow. So CRO, crow, I cry when I see cherries, and servo is blood. Alright guys, that brings us to the end of this video. I hope you liked it. Hit that subscribe button, and I will see you guys in the next video. Take care. Bye.